This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to Healthline, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest Monica Blair, who is a program management with Grey Bruce Public Health. Today, we're going to be talking about Fall Respiratory Season Vaccines. And I have to be honest, the weather is so glorious and everything is so warm that I have to say, talking about respiratory season just feels strange. But Monica, you're here to tell us that this is the time to be thinking about vaccines for the fall season. So welcome to the program.
Thank you.
So I'm wondering if you can maybe talk to us a little bit about fall respiratory illness and what that really means. If somebody says, well, what does that really mean?
Yeah, for sure. The two main respiratory illnesses that people think about as the fall season approaches are influenza or the flu and COVID-19. So both are acute respiratory infections. They can look very similar, but are caused by unique viruses. Last season, we saw a record-breaking number of influenza cases in both Grey Bruce and provincially. So Grey Bruce reported 736 confirmed flu cases. And last year, not only did we have our highest peak week, but the period of activity appeared to have spanned longer than many prior seasons, with elevated activity levels starting in December and spanning right through to April.
Wow.
So our last case last year too was reported as late as July. We also saw 776 reported COVID cases last year, but keep in mind with these numbers that testing is not readily available or used for the general population. So these numbers only include those who require testing. So actual numbers are quite a bit higher. And then another common, go ahead.
Sorry, I just wanted to ask you, why is it higher? Is that, why higher last year?
That's a good question. I don't know. I wonder if it's just people kind of venturing out into the world more and more post-COVID, but yeah.
So that would obviously give you a bit of a concern and prompt this conversation today, because
Yes.
we sure don't want to see that happen in the area.
Yeah, no, we don't.
So
another one we do see is the respiratory syncytial virus, so often referred to as RSV. So that one is also respiratory. It's a significant lower respiratory illness that mostly affects young children under 24 months of age and older adults. And the peak season for this typically runs from November until April.
So actually, you're describing three different viruses that
Yes.
affect our breathing, our respiratory system.
Yeah.
So I guess I didn't realize all three had that same similarity. RSV, that you say that's children and older adults primarily.
Primarily.
Okay.
It's quite contagious, so anyone can get it, and you can get it multiple times. It impacts young children and older adults more. So often people will get it and feel like they have a cold, have some congestion or runny nose, cough, but then they get over it. It can be severe. It's the number one reason for hospitalization in babies under 12 months of age. And most deaths attributed to RSV have been in individuals 60 years of age and older. So it definitely has a more severe impact on those two age groups.
So this is a serious illness then.
Yeah. Yes.
Sure. Very serious.
Yeah.
So as I hear you speak, my first comment to myself is, okay, I don't want that virus. How do I protect myself and how do I protect others? Because I sure don't want to share it either.
Yeah, good question. Thank you. Hand washing, cover your cough, avoid touching your face, wash high touch surfaces wear a well-fitting mask in indoor spaces, especially if you're at high risk for infection. And most importantly, get your vaccines. So immunization remains the best defense against severe complications from flu, COVID, and RSV.
I'm noticing more and more as I'm about shopping that people are wearing masks again. And I thought, we kind of got away from wearing masks.
Mm-hmm.
It was helpful in controlling the spread.
Yeah.
But it's not the only way. And you've named a variety of ways for people, but the most critical one is vaccination.
Yeah.
And that's what we're going to talk about today.
Mm-hmm.
All right. So tell me a bit about the vaccinations, and you've named 3 viruses. Do I need 3 different vaccinations?
Yes. And there's different criteria for receiving all of them. So we have started receiving these vaccines in the province now. Since we receive them in increments, initial supplies of flu and COVID vaccines have been prioritized for hospitals, long-term care homes, retirement homes, other congregate settings that have high-risk groups living in them. Then primary care and pharmacies should receive doses starting early to mid-October for the immunization of high-risk and priority populations. As soon as these are received at the healthcare providers' offices, they may be given to those individuals in those high-risk and priority groups. And this may include hospitalized patients, hospital staff, residents and staff in long-term care homes, retirement homes, and congregate settings, and individuals who are 65 years of age and older or with certain medical conditions. And then to facilitate co-administration and vaccine uptake, all individuals in the COVID-19 and influenza high-risk priority groups are eligible to receive both vaccines as soon as they're available. And in addition to those 2, the RSV vaccine may be given at the same appointment to any individuals who qualify to receive that vaccine.
Which answers a question that I had posed to you prior to us going on air. So you're saying that I could get more than one. I don't have to go 3 different times. I can get more than one.
No, you absolutely can get more than one.
And would you recommend that?
That's what I do.
Yeah.
It's a time saver. So yeah, I would recommend it. Anyone who's giving it to you is going to give it to you likely in separate limbs. If you're getting 2 in one arm, they know how to do that to make it so that it is safe and effective. And it gets it done, gets you protected against all 3 right then and there. So.
Yeah, and the time-saving factor is really important. I mean, people lead busy lives, right?
Yeah.
And I'm always amazed, even though you mentioned certain age groups, those in the age group, seniors, are busy people. Sometimes it's very hard to find them at home. They're out and about, so it really does matter.
Yeah.
So if I'm not sure, or if I'm curious about how I would qualify, how do I find that out? Where do I go?
So the high-risk criteria for all 3 of them can be found on the Ontario Ministry of Health website,
Okay.
Which is ontario.ca/flu or /COVID or /RSV, or you can call your pharmacist, healthcare provider, or Grey Bruce Public Health to discuss the eligibility criteria for each.
I'm glad you mentioned the different options, because here in Grey Bruce, we do have people who don't have a doctor, right?
Yes.
So there are other ways for them to go and find out, certainly online, as you mentioned, or even to call the pharmacists that they would normally deal with, because they can get their injections now at pharmacies, right?
Yes.
Do all pharmacies offer that, or are there only specific ones?
Most do offer both flu and COVID. On the Grey Bruce Public Health website, there is a locator, a pharmacy locator. So you can go onto our website and it will show you what pharmacies are offering. And if we have other details about whether it's walk-in or you have to call and book an appointment, things like that, that'll be found on there too. However, probably the easiest way is just to call your local pharmacist and ask them.
Yeah, yeah. So, just a question about those who are unhoused, who don't have regular health care. How do you address their particular health needs? What happens?
Anyone can walk into a pharmacy and
Okay.
get the flu and COVID vaccines. We are the vaccine team here at Greybush Public Health too is also partnering with the SOS, so Supportive Outreach Team in Grey County, and the Bruce County Outreach Teams to offer these vaccines at some of the outreach sites as well, just to make it more accessible for folks.
So actually, there is that outreach. You go out into the community for those who may need that service as well. It sounds like there's so many different ways that individuals can get the vaccines, which is great. It's not just one spot. I can recall many times public health would have vaccine clinics, and there would just be many people.
Yes. Long lineups at those clinics for sure.
Yeah. Whereas now it sort of shares that responsibility and that demand. Does public health have those vaccine clinics still specifically for this type of vaccination?
We have 5 different sites across Grey Bruce where we offer monthly community clinics.
Okay.
And so in those clinics, we'll see anybody for any publicly funded vaccine that they want or need. So we have those, and we do plan on holding a clinic specifically for flu and COVID vaccines for individuals who are under 12 years of age, because that is a group where some pharmacies do not offer the vaccines to. Some do, so always call and check with your pharmacy to see if they offer it, but some don't. So we do have that extra clinic for that group who may have a more difficult time accessing it through pharmacy.
So you're really identifying those specific needs and then filling that need, because obviously your goal is to get the vaccine to as many people as you can, for sure.
Yes.
Now, in the past, I have learned that from the public health that sometimes the vaccines do change because they need to change. Can you explain why that would be, and is there a change for this year?
Yeah, so you're right. Every year, those vaccines do change a little bit, the flu and COVID ones anyways, and it's based on the circulating strains. So the process to determine what strains will be targeted is definitely an international effort. It's run by the World Health Organization through what's called the Global Influenza Surveillance and Response System. So what they do to make the recommendations, experts consider factors like what strains are currently circulating and causing illness worldwide, how quickly are those strains spreading, how well previous vaccines match to circulating viruses, and whether new strains might provide cross protection against related viruses. So
it's definitely researched and, and tracked.
Yes.
Yeah.
And worked on throughout the year.
Yeah. So it's important for people to realize that just because they had a vaccination last year, they need to keep it current because the virus mutates or...
Right. Absolutely. That's true for flu and COVID.
Yeah.
RSV right now, they are only recommending 1 dose for older adults. At this point, no booster is needed. It's still being watched just to see if immunity wanes over time. But at this point, RSV is a 1 shot and you're done deal. Flu and COVID are definitely annual. And there is a small group of individuals who may qualify for a second COVID shot still in the spring. But for most of us, it's once a year.
Yeah. Now, hear a lot of people who say, "Oh, I'm worried about the side effects. You know, if I am I going to get sick if I get the injection?" Can
Yeah.
you spend some time and talk about that? Because that is from year to year to year, it's a concern. People
Yes.
speak
Yep.
about.
Yep. Absolutely. The most common side effect people experience is pain or redness or swelling at the injection site.
Yeah.
This can be treated with a cold compress or over the counter pain medication like Tylenol or Advil, something like that, if needed. Some people may also feel fatigued, fevered, have chills, body aches, or headaches for a day or two after the immunization. If this occurs, it's your immune response. It's your body responding to the vaccine. Um, so just rest and drink plenty of water. As always, seek medical attention if you get symptoms that you're not able to manage at home. But for the most part, some rest should be all you need for that.
Yeah.
Um, there's also a very small risk of allergic reaction following immunization. It's very, very, very rare, and healthcare professionals who provide you with the vaccines will monitor you for those less common side effects immediately after the vaccination. So, that is something that generally will happen within the first 5 to 15 minutes after being immunized. So that's why often you're asked to hang around for 15 minutes after you receive the vaccine. But if you have any concerns in the days following your immunization, don't hesitate to reach back out to the facility that provided the vaccine.
I know this isn't on the list of questions that you sent, but is it a live virus that's in the vaccination?
No.
Okay. And that's another story you hear from that it's alive, and you're saying no, it is not.
No, it's not.
Okay. Now, in our area, I know it seems awful to even ask this question, but has it begun to circulate? Have we started to see influenza, COVID, and RSV in Grey Bruce this season?
Yes. So we did receive, like I said earlier, our last reported dose of flu vaccine from last year, we actually received that in July. So it was that's an anomaly, but it was a bit of a longer season last year. We received our first reported flu case for the 2025-2026 season the week of September 22nd. So we have already received that. COVID seems to slow down in the summer months, but we have had some COVID cases reported throughout the year. And then the typical RSV season runs from November until April each year.
Are you surprised at how early you're seeing the first case?
Not really.
Okay.
Yeah, it's maybe a little bit early, but we do tend to get some cases rolling in early in the fall. So
Now, I know that we're talking about the symptoms of COVID, for example, and trying obviously to vaccinate to not have COVID. But it's not just the immediate symptoms and the illness that people need to be aware of, because symptoms can occur as long COVID symptoms as well, correct?
honestly, that is not my area of expertise. It's something that definitely, if you're feeling like you've got some lingering symptoms from COVID, you should definitely talk to your healthcare provider, and research is ongoing about that.
Yeah.
But I can't offer a lot of insight on it, unfortunately, for you today.
No, and that's fair, because I think the more people hear about what's happening and protect themselves, I mean, the research will inform us as
Yes.
we go along about it. But for sure, it's been of interest to some.
Yeah, for sure.
For sure. So the spread of these illnesses, you mentioned about COVID, not so much in the summer, but
Yeah.
how are these spread?
They're spread through respiratory droplets or aerosols that are released when somebody talks, sneezes, coughs, or cries. Droplets can land in the mouth or nose of somebody nearby, or they can be inhaled, or they can spread if a person touches a contaminated surface and then touches their mouth or nose or eyes.
Yeah.
So hand washing, washing high touch surfaces, covering your cough, things like that are good to do. And why I mentioned those earlier. COVID is believed to spread more easily than influenza, with the potential to infect people 2 to 3 days prior to symptom onset. While the flu is primarily spread by symptomatic individuals and is most contagious in the first 3 days of illness. And then there's RSV that's slightly more contagious than many other respiratory illnesses, and anyone can get it at any age. Most people have had it by the time they're 2 years old, but you can always get it again, and it has the potential to cause severe illness.
So those individuals who live in congregate settings, like retirement homes, like perhaps community living, perhaps nursing home, what used to be called nursing homes, long-term care facilities, might be more at risk because there are more people. It's just more people around, correct?
Yeah. Just living together with other people.
Yeah, makes a difference for sure.
Yeah.
How will I know which one? So let's say I start to come down with, first of all, what would be the symptoms and how would I know the difference?
It's a good question. You may not know the difference. So all three are distinct respiratory illnesses caused by different viruses, but often present with overlapping symptoms, which makes it a real challenge to differentiate them without testing. And as we know, testing is not readily available or used for most of us. All of them affect the respiratory system. Most common symptoms may include fever, cough, sore throat, congestion, runny nose, shortness of breath, or difficulty breathing and wheezing. Headache and muscle and body aches are also typical for flu and COVID. Unique to COVID, a symptom that not everybody gets, but some do, is a loss of taste and smell that some people may experience. So, I mean, if you get that one, you can assume that you probably have COVID.
Yeah.
Not everybody will get that one though when they have COVID, so it's tough to tell.
Yeah, and sometimes the name may or may not be critical. It's just what do you do, right?
Yes.
Like you're not well.
Yeah.
So your first advice if someone starts to have symptoms, what should they do?
Seek medical care if needed.
Yeah.
But if you're able to manage your symptoms at home, then stay home. So for any respiratory symptoms, that means staying home until symptoms are improving for at least 24 hours, and then extend that to 48 hours for gastrointestinal symptoms. So if you need to leave your house during that time, though, wear a mask and avoid visiting anyone who might be more susceptible to severe infection. So that's specifically would be the very young, older adults, or folks who are immunocompromised.
So when in doubt, stay home. Don't
Yes.
spread the germs.
Yeah.
Don't share. It's not a good time to share. That's for sure. So if I was longer than a few days and not improving, would that mean that that I've had a stronger virus, or would it mean if I was vaccinated and I still started feeling horrible that the vaccine didn't work?
No, it doesn't necessarily mean either of those. Everybody's individual and everyone's immune response is individual. Also, you may not have contracted. There are lots of different viruses and lots of different things that cause respiratory symptoms out there. So whatever it is you may have contracted may not necessarily have been one of the things that you were vaccinated against.
Yeah.
So there are lots of different factors to why somebody may feel worse or may still feel ill after vaccination. If you are immunocompromised at all or have any underlying medical conditions, then you may get stronger symptoms at that point. Your body, keep an eye on things and remember to reach out for medical attention if you need to.
Yeah. When in doubt, check it out.
Yes. Yeah, that's a good one.
Go.
I'm going to use that. Thanks, Carol.
Anytime. So it is, respiratory illness is a serious and significant illness.
Yeah.
It has the potential to make people very, very ill, and people who are immunocompromised can really affect their lifespan and their quality of life. Do you have any final messages for our viewers? We've got about 3 more minutes left, Monica.
Yeah. So the most important thing to do is just try and take steps to keep ourselves and those around us healthy. And staying up to date with your vaccinations is a safe and effective way to prevent infection. Folks who meet the high-risk criteria or fit into one of the priority populations can receive those vaccines now. RSV is a little bit different. It's available for certain individuals at any time. It's not just it's a seasonal illness, but it's a vaccine that is available at any time. If you have any questions about these vaccines or your specific medical history and eligibility, reach out to your primary healthcare provider, your professional pharmacist, or public health. And if for members of just the general population who may not fit into that high-risk criteria, the flu and COVID vaccines will be available for everyone who is 6 months of age or older, who lives, works, or goes to school in Ontario as of October 27th of this year.
So that's good to know that, yeah, there is sort of a scale of who gets the first.
Yes, yeah, which is similar to other years too.
For sure, and is evidence-based and certainly quite factual. Yeah. Now, mentioned earlier, there are some people who may have allergic reactions, and there may be people who just can't have the vaccine. By all of us getting vaccinated, we actually can assist those individuals. Can you just discuss briefly about how we can also support those who are vulnerable in our community?
Yeah, so there are some people who are not able to get the vaccine, as you said, and by others around them getting vaccinated, it decreases the spread of the virus in the general community, thereby protecting those individuals as well.
Yeah, and that's important for us to realize. As a community, we can support each other in staying healthy. It's not just for us and our families, but it's for others as well. And I think that's a really important. It's why it's public health, right? The time always flies when I'm talking to public health representatives. It's just so much information you have to share, and I'm very grateful that you're here today talking about this important topic. Monica, thank you so much for your time.
Thank you for the opportunity to talk about it.
And our word is go get vaccinated. Yeah. I want to also thank our viewing and listening audience today for tuning in to HealthLink to learn about programs, services, and resources available to you and to your family. Take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Hi, I'm Carol Merton, host of HealthLink on Rogers TV. HealthLink connects home, community, and healthcare with interesting topics and speakers about your health and your community.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with